Hi, my name is Anna Sorensen. I'm a nurse practitioner and heart transplant coordinator at the University of Rochester Medical Center. We are doing this video to raise awareness about skin cancer after heart transplant. I will begin by talking about your increased risk after transplant, and then I will discuss some options to reduce your risk. I'm sure you are all aware that immunosuppression is life-sustaining after transplant. But did you realize that immunosuppression increases your risk of skin cancer dramatically? In fact, transplant patients are 65 to 250 times more likely to develop skin cancer than the general population. Although all transplant recipients are at high risk for skin cancer, heart transplant recipients are at the highest risk due to the necessity of the higher doses of immunosuppression. They rank higher than kidney, pancreas, or liver transplants. Although not often deadly, skin cancer can be very expensive to treat and it can decrease your quality of life. Early diagnosis is essential for good outcomes. Skin cancer may be difficult to identify in the early stages and most often requires the trained eye of a dermatologist. Here we have both squamous and basal cell cancers. Notice how subtle they are. I have a hard time differentiating one from a cellulitis and one from a normal mole. Although basal cell cancer is the most common type of skin cancer in the general public, squamous cell carcinoma is the most common after transplant. We know there is a direct correlation with sun exposure and skin cancers. The more sun you are exposed to is equal to the higher level of likelihood of developing skin cancer. And the truth is, skin cancer is a preventable disease. By limiting your exposure to the sun, wearing sunscreen and using protective clothing, you can prevent skin cancer. And that by doing self-skin exams and seeing a dermatologist routinely, you are more likely to identify precancerous lesions early and may require less invasive, costly, and painful treatments. Here are some things you should know that help you better understand your personal risk of developing skin cancer. Immunosuppression puts you at higher risk. This includes tacrolimus, mycophenolate, prednisone, rapamune, and cyclosporin. The cumulative lifelong time spent in the sun increases your risk of skin cancer. For example, if you grew up in Florida or Arizona, lived on the water, or used baby oil to tan in your teens, you will have an increased risk of skin cancer. Having had burns throughout your lifetime will increase your risk as well. In fact, just having 2 to 3 sunburns in your lifetime increases your risk of skin cancer. So think back to when you were a child. All of that sun exposure then increases your risk for today. You are at higher risk of skin cancer if you yourself have had skin cancer in the past or you have a family history of the disease. White males over 50 are at higher risk than other populations. Sun exposure is not a healthy way to get vitamin D. We recommend you take a vitamin D supplement if you are vitamin D deficient. It is not healthy to have a tan. In fact, the tan itself is a sign of damaged skin cells. Although light-skinned people are at higher risk to develop skin cancer, dark-skinned people are at risk as well. Understanding your risk of skin cancer is one step in preventing the disease, but there are still more things you can do to limit your risk. Do not lay in the sun. Even laying in the sun a few weeks of year can increase your risk. Never use a tanning bed. It is not a safe way to get a tan. Avoid the sun between the hours of 10 to 4. I understand this is a long stretch of time, but if you like to play golf, garden, or swim, think about going earlier or later in the day. An interesting, quick way to remember the sun's intensity is that if your shadow is shorter than your body, then the sun is at its highest point and more intense. So we recommend you stay out of the sun when your shadow is shorter than your body. It is important to understand that you can get sunburn in cloudy, cold, snowy, or sunny weather. The rules for sun protection are exactly the same. Wear your sunscreen every day. Use broad spectrum sunscreen, which will protect against both UVA and UVB rays. 15 minutes to 30 minutes before going outside, apply sun protective factor, or SPF, of at least 30 and reapply every 2 to 3 hours. More if sweating or swimming. Please do not forget about your ears, back of your neck, and your calves. SPF means you can stay in the sun longer without burning than you would if not wearing sunscreen. The higher the number, the more protection. Spray-on tans generally have no SPF and are therefore not protective against the sun. Darker colored clothing blocks more UV radiation than light colored clothing does. Some fabrics even have an SPF factor built right in. These may be an option for those of you who have a hard time limiting your sun exposure. Wearing a wide-brimmed hat may provide coverage for the top of your head, face, neck, and shoulders. A baseball cap is helpful, but not as protective. Lips are the most sensitive area exposed. Please consider an SPF 30 lip balm. Once you have a sunburn, there is not much you can do to help heal your skin. Applying moisturizers and aloe may make you feel better, but they are not effective at repairing your skin. Once the damage is done, it is done. Performing regular self-skin exams has been shown to identify skin cancers early and has led to better outcomes. We recommend that you check your skin for any changes, including changes in appearance of moles or noting wounds that will not heal. Having a partner to help look at the top of your head, neck, back, and the back of your calves is ideal. These are areas they can see and you can't. Seeing a dermatologist prior to transplant is ideal. If you do not see one prior, you should have an evaluation within the first 3 to 6 months after transplant. After that, dermatology will recommend routine follow-up. And always see your dermatologist if you know any suspicious lesions during your self-skin exams. The major take-home messages of this presentation include: number 1, understand you are higher risk than the general population solely because of your transplant. Wear sunscreen every day. Do self-skin exams monthly, and see a dermatologist routinely. For further information, please go to this website, atrisk.org. It is an excellent website that is made up of a team of healthcare professionals specifically interested in reducing your risk of skin cancer after transplantation. I hope this video was helpful. Please contact me if you have any questions.